Hi, I'm Lily Shockney. I'm the co-developer of the program WorkStride, Managing Cancer at Work. Johns Hopkins is a well-known name throughout the United States. We've pioneered procedures in breast cancer, dialysis, open heart surgery, CPR, kidney transfers and transplants, chemotherapy infusions, and much more. So what is WorkStride? It's a low-cost, high-impact employee benefit program. It enables organizations to help their employees, as well as their employees' families, on their cancer journey, whether it begins at the very start, when they're newly diagnosed, or all the way through the end into survivorship or even end of life. It provides information on how to reduce risk, recognizing early warning signs of specific types of cancers, understanding and managing treatment, even being able to work while undergoing treatment so that we can balance work, life, treatment, as well as caregiving, because many employees might be a caregiver rather than the individual diagnosed. And who do we help? We're there to help employees, those diagnosed, or those that become caregivers. And a caregiver could be a family member, could be a best friend, usually as someone that is living with the individual who has been diagnosed. But we're also there for managers and supervisors who can feel just as distressed and lost when they find out that one of their employees, in fact, has been diagnosed with a life-threatening illness. Cancer happens to 1 in 2 men and 1 in 3 women sometime in their lifetime, and the majority of the time, those individuals are going to be working when that diagnosis takes place, which also means that we need to be supporting leadership of that corporation and institution too. Supporting them by providing them statistics that lets them know what volume of employees are reaching out through the WorkStride program, what types of cancers are occurring, what type of support are we able to provide to their employees, those diagnosed as well as those caregiving. And we have a strong philosophy built into this program. The philosophy is only give cancer the time it needs to get rid of it. Don't allow it to take away any more of your time. Not your personal time, social time, family time, or even your work time. This means that most of the time, employees actually choose to be working while they're receiving their treatment, and we, as part of the WorkStride program, help make that happen. So giving you some background and history as to how did this program even come about. Terry Langbaum and myself are the co-developers. We recognized as employees here at Johns Hopkins, and we've both been here more than 36 years, that I had employees coming to me as the director of the breast center, newly diagnosed with breast cancer, being very frightened and saying, "Can you please help me? I just found out that I've got breast cancer." And I was able to sit down with those employees and talk with them, the first question usually being, am I going to die? Second question is, how much time am I going to miss from work? I don't have a lot of PTO that I've saved. I need my paycheck whole. I need my health insurance intact. And I would be able to work with that employee and with the treatment team to show the employee how a treatment plan can be dovetailed with a flexible work schedule. And that certainly has been recognized as a high employee satisfaction point. Something that Terry was seeing as an administrator was that she had 5 different people out of a group of 9 working in the administration office of oncology, diagnosed or serving as a caregiver all at the same time, 5 out of 9. How do you maintain productivity when you have that much activity going on tied up with cancer diagnoses and treatment? How do you support each of these individuals? How do you also make sure that the work's getting done? And how do you also make sure that you are meeting the needs and giving them all the resources that they deserve? So as an outgrowth of coming at this from 2 different perspectives, individually with employees helping them one-on-one, and then administratively looking from a management perspective, how do we keep the work getting done and maintain our productivity, we decided to create a program actually exclusively for our own Johns Hopkins family, our own employees, as an employee benefit. What we learned, however, was that we would be able to provide this type of tool and resource and very comprehensive web-based platform supported also by certified oncology nurse navigators to other businesses and corporations. When we take a look at the components of the website, it begins with screening and prevention, and there is a tool which employees can use, and they can use it confidentially because it does not go into any database, where they can enter in specific information about themselves and their medical history and family history, and it will guide them in producing a PDF they can then take to their PCP, showing them that they are at higher risk for certain types of cancers and how to go about reducing those risks. Also gives them information what types of preventative measures can be taken to reduce their risk and how to focus on early detection. The warning signs that they may have cancer growing and how to go about getting that medically investigated and addressed. And additionally, for those that are diagnosed, giving them the initial information that they need to guide them into the right hands. And I say the right hands because there's many different levels of institutions that provide cancer treatment. Depending on the type of cancer someone has and the stage of that disease will very much determine what's the right treatment plan given by the right treatment team in the right setting. So someone with an early stage, easy to take care of cancer certainly should be able to be managed at a community cancer center. But someone with a very complex cancer and may also have other medical issues as well usually needs to be triaged into the arms of someone who is at a comprehensive cancer center. And there's information about how to address treatment while also working, when you may need to take off, when you may not need to be taking off. An entire section for caregivers. These are individuals that get drafted all of a sudden into caregiving a loved one. So they're trying to balance their work schedule with you while also balancing the needs of their loved one who's been diagnosed, figure out what appointments to attend, which ones perhaps they don't need to, and also how to maintain caregiver resiliency, because this can be very exhausting, and it also can be going on for a very long time. This could be 9 months to a year, or even longer than that they're supporting a loved one. The types of cancer that an individual has a special section on the web-based portal so that they can read about their cancer, how is it diagnosed, how is it treated, the staging of it, how severe it is, how worrisome it is, based on being able to even interpret the information from tests and from pathology results. Coping is for everyone. Coping for the employee diagnosed, for the caregiver supporting the patient, as well as for the manager and supervisor. Not just emotionally coping, but realizing that this is going to be a long-term process and it's going to be a very fluid process. The treatment may be set at one point, and based on test results that come in, that treatment plan then may change. How do you cope with constant fluidity of cancer treatment? And that section helps you with that, as well as the Navigator supporting you with that as well. There's also information about finances and actually specific regulations. There are state regulations and federal regulations that are in place to support individuals with medical disabilities, and cancer is classified as a disability. We want to make sure that the employee knows what their rights are, but also that the manager and supervisor also knows the correct things to say and not to say, how to interpret FMLA, how to interpret flexible work schedules, so that the employee and their manager can work as a team during this cancer journey. And then last but not least, there's a special portal exclusively for managers and supervisors that provides them education and resources, how to maintain productivity, also the importance of respecting confidentiality of their employee, how to communicate with coworkers, particularly those that may be asking curious questions about what's going on with an individual that's dealing with some medical problem. So as you can see, based on all this, there truly is a wealth of information that is available through the web-based platform. There also is, as I mentioned, a very special feature, a unique feature, which is that it also comes with a certified oncology nurse and navigator. This is an individual who's been trained at Johns Hopkins to fulfill this role. It is key that they always maintain confidentiality for the employee as well as for the manager and supervisors. They provide information, resources, local resources, regional resources, and even national resources, whether it be a barrier to treatment such as transportation, or financial resources because they have large co-payments and deductibles and may need financial help with overcoming them, as well as support. Psychological support, psychosocial support, and it's not limited to just the individual being diagnosed. It's also available there for the caregivers and their family and for those that are functioning in the workplace as their supervisor and manager. This individual is their guide across the continuum of care from the point where they identify a suspicious finding all the way through to diagnosing the cancer, getting the cancer treated, moving into short-term survivorship, then long-term survivorship, or in some cases, for those individuals that will lose their life to cancer on into end of life. She is truly functioning as the employee advocate as well as the supervisor and manager advocate and functions as a team to support that institution. Now you're going to take a look at a brief demonstration of WorkStride.
Welcome to the WorkStride online portal. As you explore it, you'll notice it's easy to navigate, but here are some highlights. You'll find sections to easily access information about screening and prevention, what to do if someone's diagnosed, balancing treatment and work, being a caregiver, various cancer types, coping with the disease, even financial and law resources. Managers also have a section filled with information needed to support employees through screening and prevention, a diagnosis, caregiving, and more. Since one of the most important components is the nurse navigator, we have shortcuts to contact them at the bottom of every page, as well as on the top section. Also consistently at the top, you will find the main navigation bar, where you can easily access information included in the different sections. If you know exactly what you're looking for, you can also use our handy search tool. To navigate to the home page, you can click on any of the Johns Hopkins logos, either on the top or at the bottom of every page. On the News and Views section, you will find timely informational articles. And again, remember that your nurse navigator is easy to contact by email, phone, text, or video message, and available to help you with any question or concern.
I hope this has provided you a good overview of what WorkStride is all about. This program is truly designed for any business or corporation who have employees and managers who need to work hand in hand when dealing with a cancer crisis. You've also seen a demo today that gives you a sneak peek at what the web-based platform looks like. There's a lot of videos that are also on the web-based platform that provide the ability for an employee and manager to do role-playing with one another, even before they sit down to discuss the fact that their employee has been diagnosed. I want to again emphasize that 1 in 2 men and 1 in 3 women will be diagnosed with a life-threatening cancer in their lifetime, and many of these individuals are going to be employees, probably working for you. Thank you very much.